Intraoral cameras are a vital piece of technology that we utilize daily. If you've never seen one or had one used on you before, it's really quite simple. The camera looks like a thin wand and it's plugged into the in-op computer. All the operator has to do is point and click to secure an image. There's no radiation as it's merely a photo, and there's no charge to the patient for these images. These cameras allow us to capture images for a variety of reasons. One such reason is for insurance claims. We can attach these photos, along with required x-ray, to insurance claims to demonstrate the treatment provided and why it was necessary. This helps ensure accurate, expedited claims processing the first time. Another reason we take intraoral photos is for patient education. For example, by utilizing the camera, we are able to show a patient an area of the mouth that needs improvement or extra attention when they're brushing or flossing. For instance, we might tell a patient that they are missing the back molar completely when they're brushing, but being able to show the patient the tooth covered in plaque and surrounded by red, bleeding gums is priceless. And finally, possibly the most widely used reason for taking these photos is simply for documentation in real time. For instance, if a patient has a tooth with a large, aging restoration, and there are also cracks or craze lines on the tooth, we know that this tooth is at an increased risk of fracture. At this point, we are going to take photos of the tooth and place a watch in the patient's chart. That tooth is now on our radar, and that initial photo allows us to be able to look back and compare to see if the cracks have progressed. Another thing we may document is a lesion or sore in the mouth. The doctor will usually question the patient as to how long the lesion has been there, and then will make a recommendation as to when the area should be rechecked, which may be at their next hygiene appointment, or perhaps in a week or two if the doctor is suspicious of a more time-sensitive diagnosis. Again, that initial photo is our baseline for comparison. So again, intraoral cameras are an invaluable tool that we use at Restore on a daily basis. All 19 of our operatories are equipped with them, so you never know when you might be in the spotlight.